What's going on, guys? Buddy Banter, back in the studio.
Back again.
Episode 14.
Here we go.
Special guest, Dr. Charlene Locklear. We have a very special message today. It is October. It is Save the Boobies.
Save the titty month.
For the month.
Breast Cancer Awareness Month.
That we're saving the
All
titties.
month long.
All month. We're saving the tatas.
Yep.
But today we got a very important message, very important show to get some information out to you guys, some general information, stuff you may not know, stuff you may know, and just to reiterate some things. And she's here with us today to help us out with that because we don't have the knowledge that Dr. Charlene Locklear has. My lovely fiance and Ed's lovely sister-in-law.
She's
Aw.
all right sometimes.
She's art all the time.
Well, thanks for having me. And I
Oh,
first want to
absolutely.
start off with, just a disclaimer that, this is meant for purposes of just some general information. This is not medical advice to diagnose or treat anything. So if you have any concerns about your health, particularly talking about your breast today, please contact your healthcare provider and discuss those issues with them.
Yep. Sweet. Well, I guess first and foremost, to start off, what is breast cancer?
Yeah. So, we get asked that quite a lot, what is cancer? And cancer cells are basically just our normal cells in our body that their growth cycle goes haywire.
Right.
We're either producing more than what we should, or the damaged old cells are not dying like they should. And so with those cells, the growth cycle is just in a haywire, and those cells will develop into a tumor or a mass. Okay. And that's pretty much true for any type of cancer, right? There are normal cells that their growth cycle is messed up. So,
Right.
So that is basically, what cancer is, particularly for breast, and it once again can form a mass or a tumor.
Okay.
So with that being said, are you technically born with cancer? Do you have like the gene in your DNA and it's just not activated?
So, there are, genetically, some people are prone to breast cancer. And so for them, there is definitely a genetic link. It is in their DNA. And for those people, it's not so much a matter of if they're going to get breast cancer, it's a matter of when they're going to get breast cancer. The problem with that is there's not routine screening for that. People will have to have genetic testing. Some insurances won't pay for genetic testing, and it can be upwards of $10,000.
Oh, wow.
And plus, if you do that genetic testing, especially at an early age, and you don't have life insurance, your ability to get life insurance will be basically zero. Because, like I said, it's not a matter of if, it's a matter of when it's going to happen.
Right.
Oh, wow. So you said the screening part. So, why is the screening important? What is a normal routine for screening?
Right. So how we screen for breast cancer are through mammograms. And you want really a 3D mammogram. It's more of a detailed mammogram, which is basically they're doing an x-ray of your breast tissue.
Right.
Okay. And the 3D, it's more dimensional, so you can get different views of the breast, giving you a better chance to actually detect the breast cancer.
Right.
And so your first mammogram was actually performed sometime, they say, around like 1927 to 1930 on actually a live patient. So mammograms have been around for a while now, and they've just, improved over time.
Right.
Your baseline age for screening for breast cancer is actually 40. And it depends on what guidelines you look at, because the American Cancer Society, the task force, there are different guidelines depending on what you look at. But baseline is usually age 40, and that can be annually up until a certain age, and then it can go down to every 2 years. Definitely anybody that's high risk, or as long as your insurance will pay for it, I highly recommend getting it every year.
Right.
There's really no guidelines of getting mammograms after the age of 75, but I do encourage my patients that are in good health, if you expect them to live at least another 10 years, I would continue getting breast cancer screenings with mammograms. the studies say that a mammogram can detect breast cancer in the breast 2 years earlier than any other technique. So just checking your breast or a doctor checking your breast is not enough.
Right.
And also, that being said, 10 to 15% of breast cancers can be missed on mammograms, so they're not 100%. So if you feel a mass and your breast cancer is normal, it's still important to potentially get a biopsy or follow it up with an ultrasound or something, because it's not 100%. Nothing we do is, right? Um, so, also with mammograms, it's all about early detection, okay? 66% of breast cancers are actually detected at a localized stage, meaning it hasn't spread, which means they have a higher rate of survival and, treatment options. So 91% of breast cancers can have a 5-year survival. So 91% 5-year survival, and that is because of early detection, and the majority of them being detected at an early stage.
Right. And when you say localized, you just mean to the breast
Right,
itself, like
correct.
in the general area, I guess around the areolas or nipples or whatnot.
Yeah,
Would
just
be
localized to the actual breast itself, meaning it hasn't spread outside of that.
right. Gotcha. And I know we were kind of talking about this earlier with breast tissue and muscle tissue about how it actually shows up, because we were talking earlier about, can men get breast cancer, which again we've talked about it, saying, well, men have breast tissue as well,
Correct.
and the likelihood of that actually happening to men, because I'm sure it has, I wouldn't say it has to happen, but I imagine there's some kind of statistics or studies out there that show that men also can get breast cancer as well, right?
They can, it's not as common though. It really is not common to see breast cancer in males, but it can happen. About 1% of breast cancers are in men.
Right.
So in 2025, it was anticipated we'll have about 2,800 cancers in men, and somewhere around 600 of those could potentially die this year. African American males actually have the highest incidence and highest death rates of breast cancer.
Wow, men.
In men,
Oh,
yes.
wow.
Yes. So African American males, it's more common in them, and they're more likely to die if they get diagnosed.
Oh, wow.
So how would a man go about saying, "Hey, I need to get checked for breast cancer"?
Yeah. So usually, and this is true for women too, right? You feel a lump or a mass. Okay.
Right.
So I encourage my women, and men. So you have your breasts 365 days a year. Okay. Your doctor may only check it once a year, every other year. So the more familiar you get with your breast, the more likely you're going to notice when something changes, right? And so things to look for is definitely a mass, okay? And it's usually hard. It feels like a rock, and you can't really tell where it begins and it ends. It's usually not painful, but it can be. You can see changes in the skin. It can be red. It can be inflamed. And you know how the skin of an orange looks? It's kind of like bumpy and dimply.
Yeah.
Right.
That you can see those colors, or that skin changes in the breast. You can also, your nipple can retract, meaning it can be pulled back into the breast. Nipple drainage, particularly anything that's bloody coming from your nipple, is not normal. You need to get that checked out.
That's great.
So and some men, especially depending on their weight or their size, men can have actual larger breasts and can get something called gynecomastia. But a lot of times for men, it's they feel something or there's drainage.
Right.
But same for women. But really, we want to detect breast cancers before it gets to that point, especially in women, right? And like I said before, your mammograms can detect it 2 years earlier before you'd ever feel it.
Right.
So that's what we want, and that's why mammograms are so important.
That's really good. I mean, 2 years before even actually having it. So if it can detect it that far, if it's detected, do they go in and start treating you, or do they just monitor it until it develops? If it's just a detection, like how does that work? If you detect it, do you already have it?
Right.
Like,
So the mammogram is just an imaging, right? So
Mhm.
it will say, there are certain things that the radiologists who are reading the mammogram will look for, particularly something called microcalcifications,
okay,
and they'll have a specific look to it, or
right,
they'll actually see a mass itself. And so usually when that happens, they'll do an ultrasound as well, to see if it's solid or if it's a cyst, and then that will lead to a biopsy. And it's usually like a fine needle aspiration. They'll basically numb it up, take a needle, and go into that spot and pull some tissue, and they'll send it off for pathology. And that will tell us if it is cancer, and if it is cancer, what type it is. Because breast cancer has, when you break it down between the types and the hormone receptors and everything, you're looking at probably over 20 types of breast cancer. So you really got to narrow down if it is cancer, and if it is, what type it is, what receptors it's positive for, because that's going to determine treatment. And
Okay.
treatment is, is normally a combination of things. Usually surgery is involved, or, early on. There's chemotherapy, there's radiation, there's hormone therapy, there's targeted therapy. So there's a lot of different treatments that we have for breast cancer,
right,
and that's where your oncologist is going to come in to determine what treatment plan is best for you.
right. No, it's not a one size fits all type.
It's
deal.
not. It's not.
It's very very different with what it is.
Well, let's go back to the age thing. You said it's typically they get it when they're 40, right?
Well, no. So the average age for getting breast cancer
No,
is
not
62.
for getting, for being tested.
For being tested, your average, the baseline of where you start is age 40.
But we all know people that's had it a lot younger.
That is true. That is true.
What would you recommend? What age would you recommend people actually start getting tested for it?
Well, the guidelines say 40, but
the guidelines are wrong. We just said that.
I will say, in my professional opinion, I do think the screening ages should be decreased for breast cancer, because we are seeing it
more and more.
16% of breast cancers are usually under the age of 50. The average age for women diagnosed with breast cancer is actually 62. But you're right. So if you have a family history, particularly a first degree relative, so that's going to be a mother, a sister, a daughter, whatever, a first degree relative, you actually have a double the risk of getting breast cancer. So for people that are high risk, they need to start mammograms sooner, and that could be age 30, it could be age 35. Definitely something that, once again, you need to have a relationship with your provider. Definitely be aware of your family history, what runs in your family, so they can make the appropriate recommendation for you, because it's not the same for everybody.
What is the youngest age of someone that, particularly in history, that's actually gotten breast cancer?
Now, I don't know in history. Now, me personally, my youngest patient was actually 32, but I have a brother who's also a doctor, and his youngest patient was 24.
Wow. Yeah. Like that. And then that's where they get you, it's like, oh, it's the average age. They take all these numbers and they come.
Yeah, but you got to think about the amount of people, too.
Now, I know, that's what I'm saying. You got millions of people, but even still, with millions of people, your average is 40. It's like, all right.
Because you got to think about it now. Like, there are kids that are like 8, 9 years old that, like, they have huge breasts.
Oh, yeah.
At a very young age now.
Yeah, our children, the females and males, I mean, they're just, growing and developing, once again, maturing at much earlier ages now. You're starting to see those changes.
And would you say basically our food has something to do with that?
I was just about to say that.
Yeah.
Well, absolutely. So your risk factors for getting breast cancer in particular, definitely age. So age is one of our biggest risk factors. So the older you get, the higher your risk is of getting breast cancer.
Right.
Having the first degree relative, like I already mentioned, being obese, so that's a BMI over 30, smoking, alcohol consumption, having no children, so somebody who's never had children, starting your menstrual early, or stopping your menstrual late. So women that have late menopause, average age for menopause is around 51. So people that are, 56, 57, and they are still having cycles, those women are at a higher risk as well.
Oh,
So
geez.
there's definitely environmental, if you're more sedentary, you have a high sugar, high carb diet, like I said, drink alcohol, smoke, all of those things can definitely increase your risk for
Yeah.
sure.
You got to think, I mean, just like I said, the environmental factors with food and stuff. I mean, nothing we eat now is, I wouldn't say nothing, but everything's
Majority of the stuff we
natural.
eat now
It's
is mass
processed
produced.
Right.
or
Even the fruit.
well, like I said, again, go back to you can grow a full grown chicken in 2 weeks instead
Yeah.
of how many ever actual months or whatever it's supposed to take. You can take homeboy tweet and like now he's a grown man.
Yeah.
But literally have chicken legs. You know what I mean? It's
Yeah.
kind of like a fun. It's
Yeah.
like obviously it's a chicken that has legs, but like little tiny legs, but this big old body. So because if you see them when they're like in the trucks and stuff, like they honestly like can't stand
They're all,
because their bodies are so big and their legs just don't develop like that.
They won't
So
hold the weight.
they're always sitting down.
yeah.
So these HGH, human growth hormones
Yeah,
that
I
they're
got-
pumping them with.
I had a buddy that owned a chicken house, and I think he said their turnaround time was like 6 weeks.
Yeah,
So-
for
something crazy
for
like
a
that.
full grown chicken and it's
Yeah.
getting sold. So I mean, just that alone, and chicken is probably one of the most I would say consumed products
proteins,
that's out
yeah.
there. I mean, just think football season and game day, how many chicken wings get ate,
Yeah.
or they say, promote it's good lean protein or whatever, but really, you got all these hormones in it, so it's I would say I try to buy, that organic or naturally grown stuff, but it's still hard to find, or you're going to pay an arm and a leg for it.
I'd rather pay more for it and buy the organic.
Yeah.
Even though more
To
than
know my
likely it's
risk,
not.
to know
But I mean,
risk
you can,
factors
like
would
I
be
said, you
lower.
can go in there and you can get the generic brand of 4 chicken breasts that are like in a pack this big.
Yeah,
and you
they're
got 4.
massive.
Yeah, they're massive. Or you can get the organic that's in the pack this small.
Yeah.
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 And I do encourage my patients, if you can, and once again, in this day and age, and our society and the finances, there's a lot of people that are not going to be able to afford organic and fresh
Right.
fruits and fresh vegetables
Yeah.
every day or every week, right? But I do encourage patients that, if they can, to go as organic as they can, right? With the meats, fresh vegetables, fresh fruits, clean them, before you eat them. I mean, because once again, insecticides, pesticides, things like that,
Yeah.
to keep the bugs off, they're going to use. But, trying to be as natural, growing your own stuff, a lot of people are doing chicken, raising their own chickens
yeah.
and getting fresh chicken
Yeah.
eggs. So
Yep.
anything you can do, drinking alkaline water, limiting everybody's, coffee and these Red Bulls and energy drinks.
Wait. We got to cut back on coffee?
Yeah.
Well, I mean, I tell people the only thing your body really needs is water. Anything you drink outside of that, you drink because you want to, not because your body needs it, right?
Yeah.
And cancer likes a more acidic environment, right? So sodas and all of these carbonated acidic drinks, those are the environments that cancer thrives in. So you really want your body more alkaline. So even drinking water, you want to look for a water that has a higher pH.
What about the flavored waters?
It's still water.
But doesn't it still have like your false sugars and stuff in it?
I mean, you do have to be careful with some of that, but it'll tell you, what kind of flavors or artificial sweeteners or no artificial sweeteners, So you do still have to be careful with some of that.
And then what's the difference between consuming real sugar and consuming artificial, lab-made sugar?
Yeah,
How
so I
does
mean,
that
there are things, and even on the sugar at one time, they had a warning that this can cause cancer. It was
wow.
literally on the label. And so you do have to be careful with artificial sweeteners. And it has other side effects as well, like headaches. So that's why I tell people water, and but everybody has their vice, right?
Oh, yeah.
Whether it's food, alcohol, smoking, just whatever. Everybody has their thing, but it's try to be as healthy as you can and make the best educated decision for your health.
I think you see a lot more people now too that are just like, oh yeah, I gotta go home and till my garden. You see more people with Like,
It's because they can't afford
well,
the
that's
grocery
what,
shop.
well, that's what I'm saying. Just, I mean, that too.
I mean, stuff's
but
expensive.
small-
I mean,
yeah,
just
smaller
going to the
gardens.
grocery store and spending $100, you'll walk out with maybe
Yeah,
one bag of stuff.
two
you
bags
know, one
at
bag or
most.
two bags
Yeah,
of
Yeah,
stuff.
about 2
two
Yeah,
bags.
about 2 bags.
But,
I mean, it's
but go
ridiculous.
grow their own stuff. Like, try to be more, conscious and aware of, you just can't get a better product than growing it yourself.
But
And
even
again,
but even then, they talk about how our soils are just so depleted at this
Right.
point of nutrients. So once again, the farmers are having to add lime or different things to the soil
Yeah,
to help
to
with the
help it,
to
right.
help. So
Yeah.
our soil just really lacks the
enrichment.
yeah. So
The
it's
nutrients.
once again, it's you do the best you can.
Yeah.
Same with your screenings. There's not screenings for every type of cancer, but we do have screenings for, particularly breast cancer. We need to take advantage of it. Excuse me. And for those people who don't have health insurance, the majority of your areas or states will have free screenings, particularly on months like this when it's breast cancer awareness. So reach out into your community and some of the healthcare resources and see if there's a screening mobile van that's going to be in your community and get a free mammogram.
And get your partners involved. Yeah, get your partners involved, because again, if you got a loved one, obviously they care for you and want to see the best for you, teach your, I guess, your husband, fiancés, boyfriends, like how to help you be aware or look for those things, during intimate times or whatever. But to be knowledgeable as well. I mean, because I wouldn't know, I would just, think, oh, it could just be some breast tissue, or, oh, hey, did you notice that? But that's what you want, like, from a partner, like, to help you, like, babe, by the way, did you see that or did you feel that?
Yeah. And I've had that. I've had women that it was their partner that found the mass or felt the lump and, encouraged them to get it checked out.
Right. Yeah. I mean,
Touch the boobies.
touch the boobies.
And I do recommend for women to check their breasts at least once a month. Maybe in the shower when they're kind of wet and soaked up and, they want to go in a circular motion kind of and go on the outside and then kind of work their way in. Always squeeze the nipple a little to see if you can get any drainage or discharge out. Like I said, anything bloody, you definitely need to call your doctor sooner rather than later, or your provider.
And if you have a significant other, and this is not happening at least once a month with it, if it's just once a month, that's a shame on y'all. 'Cause they should be getting touched a lot more than once a month.
On
But,
the regular.
On
yeah.
a regular basis.
They should be, like you said, they should be constantly, well, not constantly, but they should be on the lookout as well.
Yeah. I mean, particularly, with us talking about breast cancer, I mean, most people know at least one person that's had breast cancer. I mean,
Yeah.
it is the most common cancer in women, period, and it is the second leading cause of cancer death in women. And so it is anticipated that in 2025 there's going to be over 316,000 women that's going to have a new diagnosis, and out of those, around 42,000 of those women will die.
Oh, wow.
So when you think about things like that, and there's another statistic that says 1 in 8 women, so 1 out of every 8 women will be diagnosed with breast cancer at some point in their lifetime.
Wow.
That's a lot. You imagine every...
Yeah, you're in a group of friends.
Yeah, you're in a group of friends.
At 8 people, one of you at one point in time has the potential to get breast cancer.
Exactly.
So I know what the statistics say. Most of the time they are right, most of the time they're wrong, whatever.
Well, there's always outliers,
Yeah.
right? Yeah.
I forgot my question.
Well, I didn't. So
I did.
Going to your stat question, you had said like women that hadn't had kids or won't have kids have a high potential, or
Right. It can increase
Right.
the risk, right?
So the women that do, and then that also breastfeed. I mean, does breastfeeding help lower or cause the risk to be higher? I mean, you would think, all right, I had kids, my risk should go down a little bit. So now that I guess they're getting more attention, like you're feeding another human being, they're being groped, grabbed, kind of, again, they're producing stuff. I mean, they're kind of like a muscle, right? Well, it's being worked. I mean, what kind of
not so much for it being worked, right? Because breast tissue is more, once again, it's breast tissue and it's milk glands and it's fat, right? The muscle is underneath the breast, so it's not this is not a muscle issue. But a lot of the reason, so actually breastfeeding the studies do say that they think it does decrease your risk of breast cancer, but the majority of it is a hormonal. Because of hormonal reasons, right? Like what women's estrogen and progesterone and all these things are doing, after having the baby and during the process of feeding. But, usually that benefit is seen if you've done 12 months of feeding. So, 3 months or 4 months, not even 6 months. Like I said, most of the studies, you have to breastfeed for at least 12 months to see a benefit. But the benefit that it showed the most was in one of the breast cancers. It's called triple negative, which is a more aggressive cancer, and it has less treatment options, so people have poorer outcomes. And that particular type of cancer, it has seemed, to have some decreased risk.
Right.
So definitely, and I feel like it's encouraged, that breast is best. So we do encourage women to breastfeed when they can, but everybody's not able to, so.
Some people don't produce the amount that they need to produce.
Yeah,
Some people don't produce at all.
Well, they don't produce. Kids don't latch. I mean, they're latching issues, where, again, you produce, but the kids don't take. So then it's like, well, then what do you do? So, I mean, people still pump instead of, they can't feed, but they're producing it. So, I mean, would... I guess, pumping and feeding, I mean, technically you're releasing the milk. I mean, do you, in your opinion, do you think that still helps if you do it just as long, even though you're not?
I don't think it does.
You know what I mean? You know what I'm getting
at? If you pump and the baby doesn't latch, do you still produce as much and as long? Or probably not.
Yeah, that's kind of where I'm getting at. Like you might be doing it.
Yeah, babies are much more effective suckers. Okay, than your pumps, right? So your pumps, once again, they make better ones now than what they used to. But it is that suckling and that suction, that helps stimulate the milk to come down and those hormone production and all of that. So, but your baby is always going to be more powerful than the machine.
Right.
So, but anything, even pumping, anything you can do to really just still stimulate those breasts and that milk and those hormones, can be helpful.
Well, I think husbands only help maybe in the instance that you have repeated many times that I've heard the stories over and over.
Hey, breast milk is amazing.
Yeah. Again, when breast is best, then comes the breast milk. This man has his own set of stories.
Oh, yeah.
Oh, trust me. When a woman's milk duct gets clogged, she's willing to do just about anything.
And that's the thing. Another thing, too. Could clogged ducts contribute to having cancer?
Not necessarily, no. But
so they can't, get clogged up and, in the long run cause cancer, right?
No, not that I know of, no.
Yeah,
basically, whatever is in there, the body would basically reconsume it.
Yeah, because like I said, you got to remember these breast cells, are basically something in them. And once again, whether it's environmental or genetic, it's like somebody flipped a switch and something just goes haywire with the cells.
Right.
And so, I mean, that really is what happens with cancer.
Stress could cause it. A traumatic incident in life, could that cause it? Of course, being hit in the breast can cause it.
Well, you do have to be careful with trauma, significant trauma to the breast, because that has more of what we call fat necrosis to the breast. But some women also have fibrocystic breasts, meaning they have a lot of cysts in their breasts, and people that have severe cases of that may also have an increased risk. But like I said, a lot of this is going to be genetic or, more environmental, really, because you guys remember, I don't even know if I said it earlier, but the majority of breast cancers, and I mean the majority, do not have a family history. Okay, so it's not genetic.
Right.
And so, but there are, some cancers, that are, but the vast majority do not have a family history. So this is not genetically linked. So that's where the environmental stuff, like I said, your smoking, your alcohol, not having children, not breastfeeding, starting your period early, menopause, all these things, play a role in what happens to those cells.
Now, when you were talking about just women that have kids and the hormonal issues and stuff. I mean, just a particular type of treatment, like, would it be like recommended to get hormone therapy, like to help with those imbalances? Again, you want to limit as many risks as possible, and if I guess hormones are a contributing factor, I mean, that would obviously be a recommended thing to do.
Well, you have to be very careful with when you're talking about hormone replacement therapy, if that's what you're referring to,
Right.
because there are some type of manufactured estrogens that actually have a increased risk of breast cancer.
Wow.
So definitely in someone that's got a family history, you would want to avoid those medicines, but
seek a different kind of
or seek a different alternative, or just not do it at all, right? So once again, that's going to be on a patient specifics, right? This is, once again, not cookie cutter. You cannot do the same screening, the same treatment, the same test for everybody. Like, this is really going to be a tailored thing, and that's why it's such an important thing to have a good relationship with your provider, and they know you and you know them, and you develop that relationship, and honestly know what runs in your family. A lot of people in families, they can be very private and they don't want to discuss their health concerns. So some of my patients, they'll find out after the fact that this person had it and this person had it, or they didn't know that their great grandma or somebody had, because families don't talk about their health a lot, right? But it is important to get a little nosy and know what runs in your family.
Yeah.
Have you ever had a situation where you had like identical twins and one got it and the other didn't?
No, I've never had that situation.
Okay.
But once again, if we're talking about environmental and it not being genetic, identical twins are genetically identical, but environmentally, if this one over here runs, doesn't smoke, doesn't drink alcohol, eats organic, and this one is obese and smokes and drinks and
eating honey buns,
eats, fast food.
So one's a slob and the other one's not. That's what
I
I'm
mean,
saying.
once again, there's definitely an environmental factor here, right? So that can change even in different countries. Particularly women from India. If they come to this country, they have a lower cancer risk living in India. But if they move to our country, their risk of breast cancer goes up within an equivalent to an American's, I think, within 3 to 5 years.
Is that because of the food?
I think it's what you have access to.
What you have access to, once again, our environment, how
That's
we're growing
crazy.
stuff, raising stuff, our soil, once again, environmental. So, there's even, like I said, there are statistics and things you can look up where people that come from countries that have a lower incidence and they move to the United States, that their incidence will become the same as ours within a few years.
Yeah, I don't know how many McDonald's you hear about in India.
Do you know, just because it says it's called an all beef patty, but it's not all beef. It's the name of the company. It's called All Beef.
Oh, really?
Yes.
Are you for real? I
100%.
I thought it was because
Nope.
as long as they met the standards, as long
The
as there was a
name-
certain percentage in the meat, you could classify it as all beef.
The name of the company that they get it from is All Beef.
That's, well, and I just said in my mind that's hilarious. I mean, it's really not, but that's like a, that's like man, right there just make you like not want to do that. I mean, you eat a hamburger from McDonald's and feel miserable, and it's just
Absolutely. Fast food now
just
makes
a
me
patty.
feel
Yeah,
like shit.
absolutely disgusting. It's like, geez, like I barely eat, but now I can go down to the sushi place and I can eat 14, 18 pieces of sushi rolls.
Easy.
Some rice.
Feel great
with white rice and tuna or salmon. Like I would say fresh fishes, but you know what I mean.
Right.
Yeah.
Fishes and stuff like that, and get full after like my 20-second piece. But I can eat a hand. Hell, you can eat a handful of fries and like, man, like I'm full.
Yeah.
But and that just goes to show you right there, like, that's not natural.
The chemicals in the food is horrible.
It's not
for us.
natural.
Yeah.
But you get that salt
you know-
on your lips and you're done for.
But once again, the time that we live in, you got more, families where both parents are having to work. This is not like, 70 years ago where the women were at home and men were on the farm or in the factory or wherever.
Yeah.
You know, you got both parents working. You know, people are, you know, stretched thin with time and money. And so, you know, it's fast food's convenient. It's easy. You know,
Yeah.
you worked late. You didn't have time to cook, you know. Or like I said, how cheap is it to go to Walmart and buy your, or go to McDonald's and buy your kid a Happy Meal?
That's about the same price now. A Happy Meal now for a kid is like $6 or $7.
Yeah, it's like $6.
Well, depending on which one you get, but
Yeah.
but you know, still, it's we're in a time of convenience, and sometimes that means eating the fast food or eating out,
Yeah.
or you know, not cooking the things, or you can buy the hamburger helper for the family instead of, you know, making a
Yeah.
chicken, or you know, I mean, it's just that's just the time we live in.
Yeah.
So it's do what you can, right? Eat, and most people know what's good and what's bad, right? As far as food, we know fried chicken is, you know, not good, right? Or the grilled's better than a fried, you know, and fruits are better than, you know, your French fries type thing. But you know, just try to make the best decisions you can for yourself and your family and what you you know, can afford.
What if they decided to eat fried foods, but they fried it in tallow and not vegetable oil or peanut oil?
Yeah, well, I mean, vegetable oil
Is
is
that-
actually
would
one of the
that-
worst ones you can use.
Right.
Yeah.
So, you know, if you're going to use oil, you know, usually your olive oils are going to
But
be your
tallow is
cleaner.
all natural.
Yeah,
Yeah.
like
Beef
beef
tallow.
tallow.
Yeah.
Yeah. So, yeah, so once again, if you got to fry it or you got to use oil, there are better oils to use, right? Or a lot of people air fry
Air fry,
now,
yeah, air fry.
where
Air fryer's
there's not oil
awesome.
at
Air
all.
fryer's great,
You
yeah.
know, and take the skin off your chicken. That's
Yeah.
literally fat. So take the skin off, and use your, you know, your boneless, skinless chicken and
Right.
air fry it. So, just you know, environmentally change what you can change, because we have to eat, right? You
Yeah.
have to drink, you have to eat, you know. So just do the best you can.
Right.
And I do want to mention a few things. You know, I did just talk a little bit about, you know, ethnicities or racial groups. So I will say, Caucasian women do have a higher incidence of breast cancer, meaning they're more likely to get it or have higher rates of it. But your African American women have lower rates of it, but they're also more likely to die from breast cancer. And part of that is women, African American women, typically have higher rates of that triple negative breast cancer I was talking about,
Right.
that has less treatment options. And I already mentioned that black males also have the highest incidence of you know, getting it, plus the highest incidence of dying. American Indian women, interestingly enough, all the other, once again, with mammograms and screenings and people's access to health care, the majority of your death rates since the 1990s have decreased in basically every other race or ethnic group except American Indians. Our death rates have remained the same despite everything. So, and not really sure why that is. You know, like I said, people's access to health care, you know, some minority groups, you know, really have a distrust for the health care community and hospitals, so they kind of avoid it. You know, so there are different things in there, but those are just a few statistics as far as ethnicities and what you can expect.
Now, so with the Native American women, like, with it not changing, like, when did you say since when, like that?
The 1990s.
Okay, I mean, so that wasn't too far ago. I mean, what, 25 years ago, something like that. But
35.
is it 35? Well, so you got to think, if it hasn't changed, I mean, I would almost rather for it. I mean, obviously you want it to go down, but the fact that it hasn't went up, I mean, kind of makes you feel a little better that maybe.
But nobody's has gone up, right? All other ethnicities or racial groups,
Went
it's
down.
been decreasing
but
since the 1990s. But ours is not. Ours is
Is
staying
that
here.
because there's fewer amount of Native Americans than there are other races?
That's a good question. I mean,
Or-
I don't know if it's so, you know, I'm sure they do it by, you know, the percentage or the the overall
populace.
population, because it's a
Right.
percentage, right?
Yeah.
So I would probably say no, but once again, you got to think about how many Native Americans are still on reservations.
just about to say
you
that.
know what their access is to health care. You know, even their living situations. If you go out west
Yeah.
on some of these reservations, you know, some of these, you know,
They
people
still don't have running water.
yeah, they don't have running water. You know, they're using outhouses. You know, the soil's not equipped, you know, to farm like they need to.
Right.
So there's once again there's a lot of, you know, speculation as to why this could be. Um, but it's just once again it's a statistic, particularly in our area. Once again, we're in Robeson County and we have a high Native American population, and so you know it's just an interesting thought. So, but I encourage all women, you know, to get your mammograms. Talk to your providers, and any men, you know, that find anything wrong, you know, a lump or skin or changes, talk to your doctor. Don't just assume it's okay.
Yeah, I think that's what a lot of men end up dealing with. It's just like, I'm just fine. Like I'm just sore, or they could make up something in their head like, oh, well, I did run into something the other day, and
Yes,
and
exactly.
and I hurt myself, you know, and it's just
Exactly.
tender. And then a week, two later, like, man, like that still kind of hurts, and be like, well, you know, again,
It
make
is
up
what it
make
is.
up a
Yeah.
new story, like,
Yeah.
well, I did do this, or I went and worked out, and we kind of talked about this off camera, but so just like that, I mentioned like working out. So obviously, breast tissue and muscle tissue would show up different on your mammogram screening,
Exactly.
correct?
Exactly.
Okay. So well, again, obviously, it's muscle tissue and then breast tissue.
Is
so,
different, correct?
Got you.
Yeah.
Okay.
But it's, you know, this is a, you know, it's a very serious, you know, topic, you know, and it's one that's close to my heart, you know, and I see a lot of cancers, period, in general.
Yeah.
And I would probably even say now I've been a doctor for 17 years, and you know, probably in the last 7 years I have seen more cancer than I ever have in my training or you know, prior to me even being a doctor, and during my medical school residency. You know, I've been a doctor for, you know, this whole time. But and I've even talked with other providers, particularly some specialists that say the same thing.
Just notice the increases.
Yeah, I mean, it's just I would say every day I have a patient that's either a cancer survivor, is going through cancer treatments, or I'm working them up for cancer. So,
Right.
And there was one day in the last month, I had 7 cancer patients in one day. And I also do hospice. So I have a lot of patients with cancer that are terminal, you know, and are going to pass from this.
Right.
And so I deal with this, I would say, definitely on a daily basis.
Yeah.
And I even have close, you know, friends and families, you know, that have been through multiple types of cancers, including breast, which leads me, you know, to the next point. When you are diagnosed, a lot happens very quick, very fast. You go from living your life thinking everything's okay to boom, you know, you got the C word, and then it's this test, this surgery, that surgery, chemo or radiation, or these, you know, drugs that make you feel horrible. And, you know, these treatments are not easy. You know, your hair can fall out, your nails can fall off, people can lose weight, they're sick to their stomach, they can damage heart, they can damage nerves, they're left with scars, they're left with usually lymphedema, which is swelling of the arms because they're taking lymph nodes out. And these are not something that just happens during treatment. These are some of these they will have the rest of their life.
Right.
So the social support, you know, the support they need from family and friends, the love, you know, it's also what helps carry these people, you know, through their treatment and their journey and their fight.
Yeah.
You know, through this, especially, you know, even, you know, people that are religious or spiritual, you know, that is where they draw strength from. So I strongly encourage, you know, family members, loved ones, friends, if you have anybody that's battling cancer, please be there for them. Reach out, ask them if they're okay, if there's anything you can do, because it's life changing.
Yeah. Yeah, absolutely. So I mean, it helps give them that hope. Hey, I can do this, and help persevere and push through. That they see that they got that love and support there from
Right.
people that care about them. So
Yep.
yeah, I can.
And it's
100%
crazy
agree with that.
because people are so much more health conscious, and like gyms are packed. You see people outside walking and exercising, walking their dogs, but the numbers keep climbing.
Yeah.
That's crazy to me.
Yeah. Yeah.
Yeah. Yep.
Yeah, it's like I said. I feel, just that whole environmental thing you go back to. I mean, but at the end of the day, I mean, it's your body. You have control of what you put in your body, what you can help do. I mean, the information's out there. Obviously, this is our opinions. Just stating some facts that we've seen.
Yeah.
But going to your provider and getting their information from them, their diagnosis, and help them get you on a better plan to help lower the risk, because that's what you want to do, is lower the risk as much as possible. You have to do the work.
Yeah.
You can't just be like, oh yeah, well,
I got dealt a bad hand. Just
Yeah,
go around. I think I'll just give up.
yeah, you have to, and that goes for anything.
Yeah.
That goes
Yeah.
for not just this particular thing. It's everyday life stuff.
Right.
You have control. You can do the things necessary to help better the situation. So it's just,
Well, I mean, and you can, right? There's things we can do to try to reduce
Yeah.
our risk, right?
Yeah.
But at the end of the day, you could do everything just right,
Yeah.
and this can still
Yeah.
happen to you.
Yeah,
Okay,
that's absolutely true.
This is not saying that people that are doing CrossFit and they eat healthy and they eat clean and their BMI is a 20, that
Yeah.
it's not going to happen to them.
Yeah.
It can happen to anybody, and you can do everything just right, and it still happens, and it sucks. But do what you can as far as your screenings. Try to, live a healthier lifestyle. And if it happens to you, once again, no one fights alone.
Yep.
Okay.
I mean, and just it's still cancer related, but you hear about people that don't smoke get lung cancer.
Yep.
People that don't drink get have liver failure or something.
Yeah.
Stuff like that. So again,
Absolutely.
it's not prejudice to one thing. I mean, it just happens.
Yeah.
Even like you said, if you do everything right.
I mean, you got to think too. Just cancer in general. It does not discriminate.
Yeah, it's cells. It's in your
I mean,
body.
you got children. You got 1-year-olds,
Yeah.
2-year-olds getting cancers. I mean, what is a 1-year-old done?
Yeah.
So you got to think. It doesn't discriminate on age,
Yep.
race, gender. It's just out there. We do what we can to be healthy. Go to your doctors, get the screenings that you can, and when you know something's wrong, fight for your health.
Yep.
Fight, even if your provider's not listening. Find somebody that will.
Yep. Yep. Reach out to somebody. This is Dr. Charlene Locklear. She would be more than happy to help you, or at least get you somebody that can help you. So again, the information's out there. You just got to do the work, and this is part of our show, part of things that we want to continue to do. I mean, we laugh and play, and we do
Goofy shit.
fun and games,
Yeah.
and our what are the odds. But at the end of the day, we're here again to talk about our lives, things we like, but also have important information out there to people that for some reason can't get the information, with us being in a day and age of technology. But just to help show support, show love, and again, bring people on like Dr. Charlene Locklear to help us out again, because there's things that I wouldn't have known, being, I guess, just a male, thinking, oh, well, it's breast cancer, it's only specific to women. Well, that's just not a true statement, but just help us in general to knowledge is key, right?
Yeah.
Knowledge is power.
Knowledge is power.
The more you know, the
G.I.
better
Joe.
you can. Is that what they say?
Yeah,
Huh?
hopefully you guys will have me on again, and we can talk about something
Yeah,
else.
We talk about
you know?
something else.
Yeah. Or just be on in general,
Yeah.
Not as Dr. Charlene Locklear. She'll be Dr. Charlene Locklear the normal. She won't be
Just
in
Charlene.
Yeah. You'll be in normal mode. You don't have
Yeah.
to be in doctor mode. With the statting us up. But it's good information, and I'm glad you found time in your busy schedule to come on and talk to us and help us out.
You're welcome.
It's much appreciated.
Awesome.
She was gonna kiss me, but she didn't want to do it on camera. Could see it in her eyes.
It's all right. You can kiss me.
I could see it in her eyes. She was like, "Ooh," she's like, "You
Yeah.
know what? I'm gonna kiss your face."
Oh,
Save that shit for another time. Not today. But yeah, get up, move, don't be stagnant.
Yep.
If you can afford better, do better.
Yeah.
Because somebody said to me once, either ways you can pay for it now out of your pocket or you can pay for it later with your health.
That's good.
Yeah.
That's pretty good. I never heard it before. But guys, let's say, hey, the information's there, and if you need anything, contact your local provider. If you don't have one, contact one, and till next time, we'll be here for the laughs, the jokes, and with some more What Are the Odds. We got some more things coming up with some more special guests. We actually got a couple lined up, and people that have contacted like, hey, like I want to get on. I want to do the show. I want to get on the podcast. So it's nice to know that people at least are watching it and want to be involved. Because again, it's not just about us. I mean, it's just about everything. And we enjoy doing it. We'll keep doing it until we're like, you know what? I don't know, but we enjoy it. We get to
we get to hang out and talk.
Get to spend moments like these together, and it's just really appreciated. And like I said, we really appreciate all you guys and commenting and hitting us up and asking us what's next and stuff. So we like to not give too much information, but we definitely, we'll hint around, like, oh, well, we got this in mind. So I can't wait to have some of our other guests on, and kind of go from there. It's going to be fun.
Sweet.
I'm excited about the one with Chris, too.
Yeah.
Chris,
that was going to be awesome.
One with Pop.
When are we doing that?
I don't know, soon. We get it soon.
Yeah, we need to do it soon.
Yeah,
We're doing it on
we
Friday or Saturday?
Probably Saturday.
You let me know. I'll be there.
Get all the almonds together and hang out and
Yeah.
go shopping and stuff.
That's cool.
But like it, comment, subscribe. Like I said, on Facebook, Instagram, and we got stories on TikTok. We put out little clips. So just share it and get it out there with everybody, and we'll keep the content coming.
Yep.
So till next time.